And I'm going to talk today about being your own best advocate. And I'm just waiting on the PowerPoint slides to pop up. So today I'm going to talk about how you can be an advocate for yourself, as well as give just a real brief overview of sickle cell disease. I know we've covered a lot of information already about it, as well as talk about health disparities, how that impacts your care, and how other people can also be advocates for you. So whether that's your primary care physician, friends or family, but I want to share some tips on advocacy in the hospital, and what are the best ways to go about setting that up. So we talked briefly already about sickle cell disease and what that means. Hopefully we'll get the PowerPoints up so you can see them shortly. But sickle cell disease is a trait that is carried, as you heard before. We talked about a lot of gene therapy and how sickle cell disease the cells, so I'm not going to spend a lot of time about that. But if you have two parents that have sickle cell trait, there are 4 possible outcomes if they have 4 children. So one child might have the actual disease of sickle cell, one child might carry the trait, and then there may also be 2 children that are not affected at all by sickle cell disease. So just sharing, one would not have it, one would have it, and 2 would have the gene as carriers. So hopefully we can get those slides up so you can take a look at that. We also discussed already signs and symptoms related to sickle cell disease and how that impacts the body. One thing I think that's really important to remember is that sickle cell really affects every system in the body. So whether we're talking about the brain, the joints, the limbs, sickle cell disease impacts every bodily system. Dr. Simone did a great job kind of walking us through how that impacts our body, that wear and tear that continually happens when one is experiencing sickle cell disease, but also primarily when one is experiencing a crisis. So around health disparities are differences in the incident, prevalence, and mortality of a disease, and the related adverse health conditions that exist among a specific population group. If you could fast forward to about slide number 7.
Slide 7.
One more.
7.
One more. Thank you. Go back. And so knowing and understanding health disparities really can help you address your own health care. So health disparities, when we talk about the outcomes, we're aware that African Americans experience poorer life expectancies than other populations. Also with that, patients with sickle cell disease have the highest rate of hospital returns. So knowing that that is a chronic condition, we still have a lot of misinformation out there as to how people with sickle cell disease are treated. Also, the rate of stroke for those who suffer sickle cell disease are 3 times higher than other African Americans that do not experience sickle cell disease. So it's really important to know those outcomes so that we can be the best advocate for our voice and explaining the why behind why it's important to be heard. Next slide, please.
Next slide.
Thank you. So another disparity that we see are the resources around sickle cell disease. So the majority of sickle cell patients are Medicaid beneficiaries. We also see a huge number of states that are requesting to not have Medicaid expanded. So when you talk about providers that are available to care for those with sickle cell disease, we clearly have some disparities. If we were talking about some other conditions that do not have Medicaid supported individuals, people want to care for those populations. So we see a significant, if you mapped it out on a map, a significant difference in where the African American populations are living at in the United States and where the Medicaid providers are available. So what is the why behind that? I mean, we don't know. Is it racism? Is it politics? Is it some other factor? But I think it's just important if you're experiencing or have a loved one that has sickle cell disease to be an advocate not just for their health care, but also in the political arena as we talk about Medicare and Medicaid expansion. Another healthcare disparity around resources is that there are longer wait times for those that are experiencing sickle cell disease. I'm going to talk a little more about that on a different slide, but also the number of physicians that are willing and trained to treat sickle cell disease patients is also a significant disparity. For the number of individuals that are experiencing sickle cell disease, there is not nearly enough providers that specialize in that as a treatment or as a disease. Next slide, please. So why do patients need advocacy? If me talking about the health disparities didn't help you understand, I'll go back to a term, I believe Dr. Simone also used the word invisible. That sickle cell disease is really invisible. You know, if you walk into the emergency department and you have a limb cut off, you get a treatment pretty quickly, right? If you walk in and you're having a stroke, you're gonna get treatment pretty quickly. It's something people look at you, they see it, and they wanna respond and help. With sickle cell disease, individuals are walking in, and like she said, a lot of times people are waiting until their pain is at a 10 out of 10 before they're going into the hospital because they're not getting treatment when they walk in at a 5 out of 10. So sickle cell is kind of seen as that invisible disease. There isn't any imaging that can be done on their body to say, here's the level of damage that's happening when people are in crisis. But it's really important for people to understand that pain equals damage. And when you're in the emergency department, it's important to be an advocate or have an advocate with you so that you can get the care you need. Patients are expected to sit quietly and await treatment. I love the suggestion about putting a blanket, bringing a blanket with you so that you can stretch out on the floor. That might motivate them to move a little quicker. But I think even more importantly, being that voice for yourself and talking about what your needs are, having a treatment plan, having a physician that supports you and can be an advocate for you are also ways that we can get the care we need. Next slide, please. So this is an emergency room guideline that I'm not sure how many people are aware of, but this was developed by the National Institute of Health, the NIH, and also the American Society of Hematology. And it's a guideline that states a patient with sickle cell disease in an acute vaso-occlusive crisis should be seen and evaluated 30 minutes from triage or 1 hour from their arrival in order to prevent end organ damage. So one thing I do know as a registered nurse and working in healthcare for 20 plus years is hospitals don't like to be sued. So when we walk in and we start saying, I'm aware that within 30 minutes I'm to be receiving treatment, and we're pulling out our NIH guidelines and we're opening up our binder and showing them that we're aware of that, your time of waiting will decrease. So how we walk in with education and how we teach others to be our advocates and have a voice and be educated for our needs is really important. Next slide. So there are three main types of advocacy that I just want to address. So self-advocacy, which we talked about, friends and family being advocates for you, and healthcare provider advocacy. So again, we don't want anyone with sickle cell disease receiving their primary care in the emergency department. They need to have a primary doctor that specializes in sickle cell disease so that they can receive the proper care and advocacy that they need. Next slide. Self-advocacy. So number one thing I tell any patient, I don't care what disease or disorder you have, is you have to educate yourself about your illness. You have to know what the guidelines are, know what the recommendations are, stay up on research. And I know a lot of people would say, well, that's not really my job, that's what my doctor is for. But we have to be our best advocates. And when your doctor is not there for you, or you're going to the emergency department at 2 o'clock in the morning, you want to make sure that you have the knowledge to have your needs met. In addition, discuss your needs with your primary care provider. So whether you're seeing a hematologist or an oncologist, or just a primary internal medicine doctor, discuss your needs with them. Talk about a treatment plan. Talk about how are we going to manage my crisis next time it happens. Talk about what worked well for the last time. I love the suggestion of coming into the emergency department and asking for IV fluids first. You know, get that out there that I need to get a line started. I know I need to have fluids. I know that's worked for me really well in the past. And then as a side note, we slip in and can I have something for pain? Because we know that there's a lot of stigma when it comes to requesting pain medicine in the emergency department. And patients with sickle cell disease can be seen as drug seeking. So I think it's really important for us to express our needs, have our provider on board with it. And I'm going to talk also about creating a healthcare binder. And what does that mean? So when I walk into the emergency room, I want to make sure every time I go, I bring my binder with me. Next slide, please. So in that health resource binder, we want to make sure that you're including things like who's your care team, who's your physician, what's their contact information, who's on call for them when they're not available. Your provider should be able to share that information with you. You also want to make sure you have family and emergency contacts available so that they know who to call for you in the event that you're in crisis and really need someone there for you. Having your insurance information handy is another important thing, and if you can have an understanding of what your benefits include, that's also great. Advanced directives. Anyone with sickle cell disease that does not have advanced directives should put that as number one on their list. Advanced directives tell people what you want in the event that you can't speak for yourself. So you should have that information already put together. Family history. Be willing to share if you have a family history of sickle cell disease. What genetic testing have you had done? And your personal health history. So I was hospitalized last month. When I was hospitalized last month, these are the medicines I was given. Here's the IV fluids I was given, and that worked really well for me. Next slide. And I know this is kind of small to read, but your diagnosis, because it doesn't just, it might start with sickle cell disease, but there may be other mitigating factors to your health. A treatment plan of care, and you see in red I have in bold pain management, a plan that includes pain management. This is where your primary doctor can help be that silent advocate for you by putting that on paper, talking about what works for your pain and what doesn't work for your pain. Any preparation for surgery, procedures, questions that you might have. Because this health binder won't just go with you to the emergency department, but it should go with you to your primary's office as well. So you should go in, hey, these are the questions. I was seen in the emergency room and this happened. Why did that happen? What could I have done different? What should I have asked for? Test results, labs, medication lists. If you have a side effect to a medication, be willing to speak to what that side effect was and when that happened. Because a lot of times people say, well, I'm allergic to this medicine. Well, what are you allergic to and what happened? Well, I don't know. Someone just told me I was. Well, then they want to experiment and see if we give it to you, do you really have an allergy to it? So making sure that you understand what those side effects and allergies are to the medications. Any supportive care services that work for you, integrative therapies, and of course, social service networks. So if you need outside help once you're discharged, you want to make sure you include that in your binder as well. Next slide, please. Family and friends as advocates. I tell anyone that I love and care about, even people who I don't love and care about, don't go to the hospital alone. Don't ever go to a hospital alone. When you're in crisis, and that could be any crisis, not just sickle cell crisis, but when you're in crisis, your brain does not process information the same. Don't go to a hospital alone. Have another person there that can listen, be an advocate for you, speak up on your behalf. I'm thinking about even my mom was in a nursing home with my uncle who was dying of cancer, and the nurse dropped his feeding tube on the floor. Now, he probably wouldn't have noticed that, but I guarantee you my mom noticed it when she was sitting there. And she said, I hope you're not going to connect that now. And made her go get new tubing. And well, I'm telling you, had she not have said that, or had she not have been there, it might have been reconnected. It's really important to have that extra set of eyes with you. Someone else that sees it from the outside and is not in pain. For processing of information, family and friends can be great. They can write it down, they can record it on their phone, they can do whatever they need to do to preserve that information so that you have it later. But people say, well, I don't, you're a nurse, and so you would go in and you would know anybody with you is better than nobody with you. Next slide, please. Healthcare providers, advocates. So I touched on this a little bit. Have a good relationship with your doctor. If you don't have a good relationship with your doctor, you need a new doctor. And I tell people, we go to the hairdresser to get our hair done. If they screw something up with our hair, we would never go back. We go to a mechanic, they don't repair our car the way we want it. We would never take our car back there. But I don't know what it is about healthcare that I hear people all the time talking about how they don't have a good relationship with their provider, and their provider doesn't do all the things that they need them to do. Then find a new one. So keep shopping and find you a healthcare provider that's willing to be an advocate for you, willing to be a voice for you, willing to put your treatment plan on paper for you, and document what it is you need and what your wishes are. Next slide. So once again, you are your best advocate. So how that advocacy happens can be through a variety of ways. But when you're going to the emergency room next time, when you're going to see your primary care next time, I hope some of this information comes back and you pull it through and use it. So whether it's you, family and friends, provider, knowledge is power. And the more that people spend time with you in the healthcare setting, the more knowledgeable they become. You are the expert on you. So when people come and say, well, can you rate your pain for me? And you say it's 10 out of 10, and they say, well, you don't look like it's 10 out of 10. I want you to remind them that you are your best advocate, and you know what's happening in your body long before anyone else can tell you. Education is key. Next slide. And I know we don't have the ability to take any questions, but if anyone does have additional questions at all, please feel free to reach out in the comments, and they will connect you if there are questions I need to answer directly, or we'll find those resources for you. So thank you so much.